welcome to another episode of Time with a Gynae. I'm Dr. KK. It's been an interesting discussion over the past few days, and the last episode was on human papillomavirus. I focused on the vaccine that is aimed at preventing cervical cancer, and it is enrolled in our national immunization program for young girls between the age of 9 and 14. So I did an extensive discussion on that in my previous episode. If you haven't watched it, please go back and watch that video. On today's episode, I want to talk about ladies outside that age group. Now, there's also a vaccine available to those people. Just to go back a little, the vaccine that is being used now, the reason why we are focusing on the vaccine is that we know that there are the various strains of the HPV, that's the virus. There are various types. So the types that are more implicated in cervical cancer are the high risk types, and two major high risk types are the 16 and the 18. These are responsible for about 71% of the cases of HPV infection, which can eventually lead to cervical cancer. So it is justified if we are focusing on rolling out that vaccine that contains the low risk types 6 and 11, and then the high risk types 16 and 18, because these are implicated in most of the diseases. Yeah, so for those outside the age group of 9 to 14, what is out there for them, unfortunately, you will have to pay for the vaccine. That's the sad part, but it's going to save you a lot. So you have to pay for it, as I said. Now, what's available for them? There are two types. One of them, you are going to take 2 shots, and the 2 shots are taken 6 months apart. That is one type. And then one of them is also 3 shots, which they will give you the outline. So you take one, then 1 month time you take the next, then about 6 months time you take the third shot. Now, price wise, because obviously that's very important. You want to know how much it's going to cost. But I want to tell you something before I tell you the cost. If you look at the cost involved in treating even early stage cervical cancer, the cost I'm going to mention to you concerning the vaccine is low compared to the cost involved in treating early stage disease, let alone the advanced stages. So I would advise that if you need to even save up to get the money to get a vaccine, do not hesitate, because it's going to save you a lot. What's available in Ghana? We have the one that is 2 shots. It's available in Ghana. The one that's 3 shots is also available in Ghana. If you want to know where to get them, let me direct you to any government hospital around. Please walk in, tell them you want to be vaccinated. Now, the catch about the vaccine is that ideally you will have to be tested for the HPV. You have to do a test to determine whether you have the HPV already or not. Now, if you test and you have the HPV already, what we are going to do for you is a follow-up, because you already have the infection. Vaccines are meant to prevent the infection. So that is why the 9 to 14 is targeted, because the assumption is that by 9 to 14, most people will not have had their sexual debut. So that age group is more appropriate. You only receive the vaccine when you are negative, when you are tested and it's negative. All right. So the ideal thing is that be tested first. Take note that you are negative before you go ahead and receive the vaccine. If you are tested and it's positive, we will need to just do a follow-up. Now, this video I'm doing, I won't want to limit it to only women, because HPV also causes a lot of infection in men. And one of it is that it can cause penile cancer of the penis. So it is not only limited to women. So take note. The guys were like, oh, we are out of this. We are out of the woods when it comes to this. It is not the case. So you too will need some form of vaccine. But I mean, you don't see a lot of men coming around for these things. But let me focus on my women. So you need to get tested. If it's negative, you take the vaccine. The cost. So The few inquiries I made concerning the cost, I realized one shot is about 1,200. 1,200 at the government facilities. The other type is about 3,500 cities. So you need to take it seriously, because this is your health we are talking about. If you need to use about 3,000 cities to save you from getting cervical cancer in the near future, I don't think you hesitate. Right, so that is about the vaccine for those who are outside the age group of 9 to 14. First, get tested. The test is not any difficult thing. You can just walk to any lab and then tell them you want to do HPV DNA. HPV DNA, that test will let them know if you have the infection already or not. Once you are negative, you are cleared to go for the vaccine. If it's positive, we do a follow-up, give you treatment to see if the infection will clear, and then now you get a green light to take the vaccine. So this is about HPV vaccine. I recommend it to all of you. Last video I spoke about the 9 to 14 year group. Outside that year group, you can also get a vaccine. Get it now, and let's all meet the target for WHO worldwide. We are looking at an infection rate of about 4 in 100,000 women years. So all of you rally together. Let's go get HPV vaccine and prevent cervical cancer. I hope to see you alive, because you will get this vaccine and you also recommend it to others. If you have not subscribed to my channel, it is time to do so and share for others to also enjoy these contents I'm sharing with you. I will see you in the next one.